One can easily say, okay, you want a baby? Come on, let's do IVF.
IVF यानी in vitro
IVF
और IVF करते हैं.
so much misreporting going on in these IVF clinics.
But there's no diagnosis with to do IVF. There was a couple recently who had 6 or 7 pregnancy losses.
Wow.
And all they were doing is one IVF over the other. And actually they didn't need IVF. The problem that she had was just diabetic.
Got it. Dr. Firuza Parikh is a pioneering fertility specialist who has spent nearly 4 decades helping couples become parents.
She had wasted a good 8 years of her life.
And nobody caught that.
Nobody caught that. We got it under control and she did conceive on her own. Many a times we saw that the woman would be carrying a heavy file because she had gone from doctor to doctor, OPD to another OPD. But there was not even one semen analysis report of the husband.
It was all on the woman.
If you look at 100 couples, 40% would be a problem with the woman, 40% more would be a problem with the man, and 20% it will be both the woman and the man.
Can a woman have regular periods and still have a fertility problem?
Absolutely. There are so many reasons for infertility. She could be suffering, her tubes may be.
Can a man have normal erections, normal ejaculation, and a completely normal sex life, but still have a serious fertility problem?
Yes, of course. Because
So one line from your book, you say that a good IVF specialist is one who knows when not to perform IVF.
yeah.
Can you tell me about that?
Yeah. So I think first, whenever a patient comes, whether it's IVF or any other specialty, you have to listen to the patient. What happens, busy doctors, I'm not generalizing doctors, but a busy doctor must make time to make the patient sit down, make the patient comfortable, and then really go into what is the patient saying. Because a patient is not a diagnosis, he's a human being who needs our care and attention. And you can only reach a diagnosis with good clinical history, with good understanding of what the patient is saying. I'll give you some examples. Few months ago, a very young couple, 23 and husband was 24, came to me and they said, Doc, we want a baby now. And they were just married for 3 months. So I said, but what is wrong? What is the hurry? There was no diagnosis. So why would you want a baby within 3 months of marriage? So they said, but we are trying and we have still not conceived. So then you have to sit them down and explain that if you are fertile, it still takes more than 3 to 6 months to conceive naturally. Because if there is a group of people who are trying to have a baby, there will not be all who will conceive right away. So say about 25 of these will conceive in the first month and some more the next month. One can easily say, okay, you want a baby? Come on, let's do IVF. But there's no diagnosis with to do IVF. So a good doctor will always listen carefully and then if required do IVF. Otherwise, IVF is in its own, it's a very mechanical process, a very technical process. Sometimes IVF can be very traumatic. There'll be couples who have done 2 cycles, 3 cycles, up to 10 cycles, and still there is no diagnosis. Just doing 1 cycle after the other. I can give you an example here. There was a couple recently who had 6 or 7 pregnancy losses.
Wow.
And all they were doing is one IVF over the other.
Losses means like miscarriages.
Miscarriages.
My God.
And actually they didn't need IVF because they were conceiving on their own initially. Then they got into the track of IVF, but she lost the babies even with IVF. So when I sat them down and said that you don't need IVF, the wife was very relieved. She said, really? I don't need IVF? You mean to say I can conceive naturally? I said, sure. The problem that she had was a very simple problem. You'll be surprised. She was just diabetic.
Got it.
And the diabetes was missed through all the pregnancies. She would reach till 8 to 9 weeks. Her sugars would shoot up and she would lose the baby.
That, what's it called? That term, no? Something.
Gestational
diabetes.
So it was so simple. She had wasted a good 8 years of her life.
And nobody caught that.
Nobody caught that, unfortunately. So it emerged in the history. It emerged that she had blood sugar problems, but nobody had actually put a finger on it. And sure enough, we got it under control and she did conceive on her own.
Wow. So I want to talk a little bit more about trying naturally, Doc. In your book, which has quite interesting anecdotes also, you describe couples. Couples who've come for IVF and you ask them if they're having sex, and they said we're not having sex.
Yeah, it is true. It is true because and I had a couple recently married some time back. They didn't know what is sex.
Right.
They actually didn't know. I mean, it was very embarrassing for the girl. And when we asked, do you have sex? She said, yeah, 2 times, 3 times a week. That's what the husband said. And then later on, she said, can I talk to you? She said, we don't know how to make love. And it was so shocking because it's one of the most natural things to happen. But yes, we do see such outliers. And I think it's a time also to educate it, because sometimes a couple is just going through a arranged marriage. They're young. They've not been exposed to sex. It's quite an experience. It can be a traumatic experience. And many a times I've seen that if the girl doesn't know what is performance,
what to expect, there will always be anxiety. And that can also lead to them not having sex because husband is worried that, she'll have pain. So I think that is also very important when we are talking. We have one question in our proforma, and that is, how many times in a week do you have sex? And it's little embarrassing to ask someone that, but that is the reality. We need to know, are they really ready to make a baby? Do they know how to make a baby? I mean, on one level it's embarrassing, but on another level that is the only way, the natural way to make a baby. So
true.
So if you want to make a baby, this is what
it takes.
This is what it takes from since time immemorial. In whatever religion you believe in, this is what your God wanted.
True. And we see that. Yes. It's not like anecdotal. We see it very often.
Right. And how does, for a woman, how does she identify her fertile window?
Yeah.
There's apps, there's so many different things that you can do. What do you find are the best ways?
So I think never trust an app. Never trust an app, because we did a small study where we looked at different apps. Different apps gave different dates of the fertile window. The best way to track is to have an LH kit. So what happens, there's a hormone called luteinizing hormone, LH, which peaks a few hours, say 24 to 36 hours before ovulation. So if that little strip is dipped in urine starting from day 9 of the period and then daily checked for say about 5 to 6 days, then one will see the peak, a pink color line appearing, and then one can easily plan sex.
Got it.
So that's a very natural and easy way to do it. Other way to determine that a woman has ovulated is to do an ultrasound at the right, say follow up from day 9, track the follicle, see when the egg releases. That's also a very good way to do it. And other than that, I think if a couple is healthy, has a good libido, having sex 3 times a week, should ensure that those fertile days are being covered.
Automatically. But how often should a couple have sex a week if they are trying to conceive?
So there is no magic number. There'll be couples who will be having sex every day. There'll be couples who will have sex for the pleasure of it, say 2 times a week. So as long as the fertile period, which lasts say from day 9 to day 16, is covered with sex once in 2 days, 2.5 days, I think, and that is provided the woman is ovulating, provided the man has a normal sperm count, they are well covered.
Got it. Talking about sex, when you Google, my team Googled a bunch of different questions that people ask.
Yeah.
Which is, sexual positions,
yes,
pillows, legs in the air,
yeah,
which way to lie down afterwards, running to the bathroom.
Yes.
Any of this is real, or it's all myths?
These are myths.
Right.
But these are very real questions.
Right.
We are asked that all the time. What after intercourse, doctor, everything comes out? That's a common thing that is asked.
Yes.
Everything is meant to come out because the semen liquefies in the vagina. Once it comes out as a little bubble, it coagulates and then it liquefies. So that's the normal process. So you don't need to put your legs up high or really have a pillow.
People have seen that in movies,
Yes.
where the woman puts her legs up and waits there.
Yeah.
Like if it lasts longer.
Yeah. Not true. Positions also not true. Whatever is comfortable is good for the couple. Running to the bathroom, washing yourself after intercourse, also not a problem. One thing a woman should avoid is douching. Vaginal douching immediately after intercourse is not recommended. In fact, douching is not recommended at all. So these are some hygiene habits, but they're not truly hygiene. In fact, vaginal douching should not be done at all.
Can you just take us through when you had started? What was the situation then if you wanted to conceive? If you had problems or not? What was it?
So it was quite primitive at that time. The basic test done was a semen test. The husband wouldn't even show up for a semen test most of the times. The woman would have a few basic tests done. Nobody would pay attention to what her needs were. And many a times we saw that the woman would be carrying a heavy file because she had gone from doctor to doctor, OPD to another OPD. But there was not even one semen analysis report of the husband.
It was all on the woman.
It's all on the woman. And that was where the real inequality started.
Right.
That is where marriages failed because nobody could really understand what is happening to the woman. And that was something which I felt needed to be corrected because unless a woman who is believed to be the center of society, who strengthens the fabric of society, who's a mother, sister, wife, mother-in-law, so many other things. If we do not do things for her, do not bring her into the best of health, we have failed as society.
And also to understand, like you said, like that fertility is both people. It's not just the woman's burden.
Absolutely. To give you some statistics, if you look at 100 couples, 40% would be a problem with the woman, 40% more would be a problem with the man, and 20% it will be both the woman and the man. So the male partner is as responsible as the female partner. So this was missed many a time earlier. Today it's reverse. The husbands are very, very conscious of their role. Usually they come with their female partner. Usually they're very understanding. So I think the whole scenario is changing, and which is good. It strengthens the marriage. It strengthens the relationship. I would advise all couples to start, at least the woman should be 30, even below. That's the right time, I think, to enjoy the motherhood and fatherhood, and also to have your babies grow up with you.
You say that men are more involved in fertility today than they were before. So what do you think has changed?
I think the knowledge that the man can also contribute to infertility, that has made a big difference. I think social media, knowledge about IVF, reading, and sometimes the biggest icons are movie stars and celebrities who come out with their problem and talk about it. That also helps. So I think knowledge, science advancing, IVF advancing, all these things have contributed.
Got it. This is a question that we found very commonly on Google, and you must be hearing it all the time. When a man has the guts to say it, can a man have normal erections, normal ejaculation, and a completely normal sex life, but still have a serious fertility problem?
Yes, of course. Because the libido and everything is controlled by testosterone. Okay? Sometimes the testosterone may be in an average level, and so he can perform perfectly, but there may be low sperm counts. There may be low motility, which may be by a lifestyle or genetic issues, or the morphology of the sperm may be very, very poor. So there are many
So sperm count is completely different from your libido and your sex drive, let's call it.
I won't say completely, because men who are diabetic, there is a fall in the sperm count and their performance comes down.
Oh, their libido also goes down?
Everything goes down. Men who are alcoholic or consume a lot of alcohol, their libido goes down, their erection goes down.
What does semen analysis actually tell a man?
So it tells a lot. Just one semen analysis will give an idea about the count, what is the concentration of the sperm, what is the motility, is this sperm likely to be fertile, what is the morphology, is there some genetic reason? Sometimes when there's azoospermia, no sperm, then many a times it's a genetic indication or a genetic reason. Then also the quantity of the sperm matters, the kind of quality matters, the viscosity matters. It can give a lot of information. If there are bacteria in the sperm or white blood cells, then there is some infection in the prostate or in the reproductive system. Gives a lot of ideas.
So it's important to do
It's a very important test. A simple test, but very important.
Got it. And what about, all these kind of things like a mobile phone in the pocket, cycling, using a laptop on your lap, do those really affect sperm count, or is it a myth?
I would not be able to give you serious literature, although there are sporadic studies, but I would put a word of caution. These are, after all, magnetic waves. Why should one subject one's body to something which we can take care of? So my take on this would be, keep it away from you. Have a proper desk on which you can place it. Avoid keeping mobiles in the pockets. I mean, anecdotally, I know of people who have got cancer because they would, and pulmonary cancer because they would put the mobile phone in their pocket.
In the chest pocket.
In the chest pocket. Anecdote. I know women who have got breast cancer because of using the phone. I know women who have got uterine cancer because of the phone being near their hip. So if there is something which casts a doubt, why do it? Take better care of your health.
Got it.
Till research or till a good statistical analysis shows that yes, there's a connection, why do it?
Got it. We always talk about women's age, like you said, 24 to 34. What about the man's age?
Now men are lucky, very lucky. Charlie Chaplin had a baby when he was 18. But
Really?
yes, but that's not really the point. The point is, a woman is born with a fixed number of eggs, 500,000 eggs. And by the time she's 35 to 38, there are, say, a few 100,000 left. By 40, there are a few thousand left. And by 42, there are tens of hundreds left.
Oh.
So that is the disadvantage. Once an egg is born, then it will always die. In men, what happens is the sperm is replenished. So a sperm has a life of about 90 to 92 days, and then a new set of sperm is produced. So that is the advantage, and therefore, although there are studies which show that older men, say older than 50, may show decline in the sperm count, by and large, they will remain fertile late into the 60s.
There was one very memorable anecdote in your book about this man who's used to track he was like a stock market player, and he used to track his sperm count with the Sensex, and it used to be, there was a correlation between his sperm count and the Sensex. Can you tell us about that?
Yeah, so this couple who came, he was heavily into the stock market and had very little time for his wife or for anybody. Even for himself, he didn't have time. And since they had some, I think the wife has little bit of depression, and they did visit my husband Rajesh, who's a neuropsychiatrist, and he showed the whole chart, and it was showing the scale going up and down and up and down. And then Rajesh deduced that this fellow is in the stock market. So he says, now you make a chart and show me the chart where your count was down and what was the Sensex at that point. And there was a total correlation between the two, which also shows us that stress plays such an important part in the spermatogenesis.
Wow. The mind-body connection.
The mind-body connect.
That's crazy. That's another twist on the term Sensex.
Isn't it? It's a nice phrase.
Doc, you see couples at both extremes, and some panic after 3 months and want IVF, and some wait for years because they assume they have time and then they panic later.
Yeah.
What should be the mindset?
So here is a very important question. A woman's fertility is best between the age of 24 and 34. So I tell all my friends' children, look, this is your best time to have a natural pregnancy or to have a healthy baby. Try to have your first baby by the age of 30, if you can. Because that also then allows you to grow up with your baby. You are not 40 years old when you have your first child. But as you know, a woman's fertility starts declining from 36. That's when all the problems start. That's when the miscarriages occur. Sometimes there are abnormal babies because of, say, Down syndrome, Edwards syndrome, Patau syndrome. So, yes, if you want to enjoy a family and if there are no other restrictions, I would advise all couples to start, at least the woman should be 30, even below. That's the right time, I think.
I want to talk about women's fertility now, Doc, which is, of course, most important thing. The window is 24 to 34. So for many people, it's like there's a cliff at 35. Well, of course, it's more gradual.
Yeah.
But what actually changes and why is it 34 and not 35?
Yeah. No, it is a tentative figure. It doesn't mean that women after 34 becomes infertile. But when we look at graphs, when we look at the AMH of women and you do large studies, what we see that the decline in the AMH which stands for anti-Mullerian hormone, starts by 34, and there is a very gradual decline first, and then there is a cliff where there's a great fall. So AMH determines a lot of things. It correlates with the number of eggs, the quality of the eggs. So that is like a barrier. If you cross that barrier, you can fall into a cliff.
Right.
That is why it is important for women to be mindful of their reproductive health.
Right.
And AMH is a very simple test which can give us a lot of information.
So AMH, like you said, is the most important test for a woman.
Yeah.
What does it genuinely tell a woman?
Well, a woman learns a lot of things. That can she one of the ways of postponing having a child. See, if her AMH is very good, it is 3.5, and she's 34, then she has a good window in which to continue trying or delaying pregnancy. If a woman's AMH at say 32 is only 1, then that tells us that she should not waste time. She should plan for a baby soon, or at least preserve her eggs and embryos if possible. So AMH also indicates how the quality of the eggs will be. It can also, to a certain extent, predict pregnancy. What will be the chances of a woman to get pregnant? So it's a very simple, easy test, not very expensive. It's a very, I personally believe that a woman who is delaying pregnancy should do her AMH at least once in 9 months to a year.
Don't you think that even a woman who's not delaying a pregnancy, like when I hear you say how important it is, it's almost like every 30-year-old woman should do it, or 25, whatever,
Yes.
of whatever age that they...
Every Indian woman who is going to defer pregnancy by the age of 28 should start doing her AMH. This will sound very shocking, and it will be like, what am I proposing to women? I would say, please do it. It's a simple test. It will give you that window to have your freedom, not to have a baby right away. Because the moment your AMH will fall below a certain number, depending on your age, you are then entering the danger zone. Any woman who's 28, because that is the time in Indian women, we are starting to see the decline. So before the decline occurs, if you're made aware, then it's good for the woman to take
At least you know
cognizance.
everything.
You know.
Do I have to get married now? If you're not married, do I have to have a kid? Whatever it is.
Yes.
And what can AMH never tell you?
AMH can never predict whether you'll get pregnant or you won't get pregnant. But it's a very good predictor of the volume of the ovaries, the number of eggs. But it's not like it's like a horoscope. It will just predict a few things, but horoscopes don't always match up to expectations, right?
Got it. Can a woman with low AMH still conceive naturally?
A woman with low AMH, depending on her age, can still conceive naturally. I'll give you an example. My cousin's daughter had a very low AMH. It was like 0.1, hardly describable. And then COVID struck. And we were going to plan donor eggs for her. But then with COVID, we couldn't do that. Just in the middle of COVID, she calls me and says, Firuza aunty, now I've stopped my periods. Now I think because AMH was so low, she said, I think now I'm menopausal. I'll definitely come back when all this COVID and everything goes over, and can we then do donor eggs? I said, sure, do that. But why did your period suddenly stop? So she said, I don't know. I said, okay, then just do a pregnancy test. So she laughed at me and said, auntie, what are you saying? You have asked me to do donor eggs and now you're asking me to do a pregnancy test. And sure, she was pregnant. So AMH is not always a predictor that you won't get pregnant, but it is like a signal. It gives you information which you can act on.
Got it. Just want to talk about egg freezing, which is, of course, something that when you think about fertility, that's one of the big things that comes to people's mind. I love that we talked about when you're 28, you do your AMH test. And I guess the next step would be egg freezing in someone's mind in a way.
I think so. And I think it's a very good way of biological insurance, because we're seeing a trend that girls don't want to get married, or they're not finding the right man for whatever reason, or they're married and don't want to have a child right away. So an egg which is young at say 30, 34 will not be young at 40. Numbers will also come down. So I think it's a good practice to have this biological insurance and a choice to use these eggs later on.
Got it. And what is the difference between, how much does the age matter when you're freezing an egg?
It's one of the key factors to
Right.
success. The younger the egg, the better the chances. So if somebody freezes her eggs at say 28 and uses them at 38, she's much better than making embryos at 38.
And so, what age should people, like a woman, think of freezing eggs? Suppose she's married, not married, whatever it
Yeah.
is. But
So if somebody knows that she's going to be career driven, say by 25, she's holding a good position in a company, I think she should make that choice and freeze eggs. I would recommend it to, all my children's friends,
right.
and I would recommend it strongly to anyone who is going to delay her childbearing.
And what is the pro and con of freezing your egg?
So one has to realize that freezing one egg is not going to land in a baby. On an average, you need 20 to 25 eggs to translate into a baby later on. So I'll have girls coming in telling me, look, I have a free time between July and August and I want to finish egg freezing. Then I will tell them, then don't freeze your eggs, because in one cycle you may not get 20 eggs. So plan that 1 year. Give yourself that 1 year in which you may have to do 2 or 3 cycles of egg freezing.
And what does that involve?
Well, that will involve the screening, it will involve taking injections, it will involve sonographies, and of course the egg retrieval later on, and the freezing process.
Is it painful?
The injections are nowadays not painful. They're very tiny with insulin syringes. They can be self-injected. These are very pure injections, not like earlier on. So I don't think there is so-called pain. They may feel like a little mosquito bite, but nothing more than that.
And the retrieval?
Retrieval is under anesthesia.
Or you have to be under general
Yes,
anesthesia?
but very mild. The anesthesia is like it would last for about 10 to 15 minutes.
Like a sedative?
Very, very much so.
Got it. So it's a bit of a process,
Yeah.
right? Is there anything a woman should ask a clinic before she chooses a clinic that will freeze her eggs?
If they've done it before, how many have they done? Which is the best stage to freeze? What are the results? Has anything gone wrong with eggs that have been stored in the past? So these are
So that is a clinic is different from an IVF clinic, is it?
No, all IVF clinics have the ability to
I
freeze
see.
eggs.
Can a woman have regular periods and still have a fertility problem?
Absolutely. There are so many reasons for infertility. She could have fibroids in her uterus. She could be suffering from endometriosis. Her tubes may be blocked. So getting periods regularly is only one part. It tells you that yes, you are ovulating most of the times. And getting periods is more dependent on the amount of estrogen and other hormones circulating in the body. So there will be many other reproductive organs which are not doing fine, and a woman can still have periods.
You said, Doc, that you're seeing more adenomyosis,
Yes.
endometriosis, and fibroids in younger and younger women.
Yeah.
So why is that happening?
That again is many believe it's to the environment, that these chemicals are causing a growth of many cells and a lot of inflammation, because endometriosis is totally because of inflammation. So is adenomyosis. Fibroids can sometimes be genetic, but they're all dependent on estrogen. Now, many of these endocrine-disrupting chemicals are estrogens. They mimic estrogens, and that kind of spurts this disease. They bind to the receptors in the reproductive organs and then mimic estrogen. And that is why we are seeing young girls, even 15-year-olds, getting endometriosis.
So all these chemicals which are everywhere, they mimic estrogen.
They mimic estrogen.
Which is such an important hormone for women.
Yes.
I see, and that disrupts the whole system.
That
basically.
disrupts the whole system.
Wow. When it comes to periods, what symptom in a irregular period or something that would a woman dismiss as normal, but you would want investigated?
Well, if she's having heavy periods, if her periods were lighter and now they're suddenly heavy, I would definitely like to check on her uterus and her entire reproductive system. She skips a period. That also is worrisome. I would like to investigate, look at her AMH, do a sonography. If her period prolongs for a long time, if she had a 5-day period and now it becomes 8 to 10 days, I would look for fibroids. I would look for anything that is new growing in the uterus. So a period can give a lot of information about the general health of the reproductive organs.
So basically, irregular periods should be investigated.
Irregular periods should always be investigated, particularly if the periods were regular in the past.
And some women have always irregular periods. Does that happen? Oh.
Women who have polycystic ovaries can have very irregular
Got
periods.
it.
Again, it has to do with the fluctuating estrogen levels and the low progesterone levels in the body.
And can that be solved then?
It can be solved because again, PCOS is not genetic to a large extent, but also lifestyle related.
So, Doc, we've mentioned PCOS many times.
Yes.
What is PCOS?
Yeah. So it stands for polycystic ovaries syndrome. Now it is changed to polyendocrine metabolic syndrome. Because why so? Why is the title changed? Because PCOS is not just restricted to the ovary. There is dyslipidemia, there is obesity, there can be cardiac disease, there can be atherosclerosis. There can be so many things. There is androgen excess. Sometimes the woman has lot of hair on her body, lot of acne. So it is a polyendocrine disorder, and this usually the problem starts with the ovaries, which is secreting more of one hormone LH and less of another hormone called FSH.
Got it.
This balance goes, and therefore the ovaries become cystic. She doesn't ovulate, and not ovulating also causes problems with the sugars. So there is resistance to insulin, and so it is a cycle which keeps on perpetuating itself. And also it shows up as not having regular periods. She starts putting on weight. She has a poor self-image. There can be depression. So it's not just related to the ovaries.
Wow, it's like a whole body system.
Absolutely.
And that's rising.
I think it is rising. There's a trend for women to develop more and more polycystic ovaries, again because of lifestyle.
In your book, Doc, you described a woman who had 33 fibroids removed. How do you decide which fibroids actually affect fertility and which should be left behind?
So there is something known as a FIGO classification, which will classify the size, the shape, and where is the fibroid located. If they are located far from the uterine cavity and they are small, they don't need to be removed. Because 30% of women, some point in their lifespan, will have fibroids. So that helps us to decide the cluster number of fibroids, the position, the size, whether they are pressing on any organ like the urinary bladder, the ureters. Those are the fibroids that need to be removed.
Got it. You've also mentioned the gut microbiome as an under-discussed part of fertility.
Yeah.
Can you tell us about that?
Yeah, so today there is a lot of talk on the gut microbiome. These were not even thought about, say, 10 years ago. But today there's a lot of evidence that your microbiome rules your brain, rules your heart, rules women for endometriosis and fertility. So many a times for women with endometriosis, it is not just getting cysts in the ovary. It goes much beyond that. Endometriosis is a condition of inflammation in the body where the white blood cells start getting active, and then there's a whole cascade that follows. And there's some very interesting studies which show that endometriosis today is a cluster of diseases. Women with endometriosis tend to have bloating, they have indigestion, dyspepsia, dyschezia, a lot of things. They have migraines, they feel in poor health. So it's a whole cluster. And when we read deeply, the one thing that comes out is there is a dysbiosis. That means the gut microbiome is altered with an unsuitable bacteria. And that is what triggers this whole cycle of endometriosis.
Suppose a couple wants to start trying 3 months from today, to have a baby. What should the man and woman do from tomorrow morning?
Yeah. So first of all, they should do a basic checkup. Basic checkup is the weight, their what they eat, how organic are they, what are the chemicals they're using. Then look at factors of simple things. Are they having enough sex? Is the woman tracking her period? Do a simple semen analysis. And then for 3 months, just do everything. If anything doesn't happen in 3 months, that is the time when they should start doing tests. Because, you can do endless number of tests and not need them.
particularly if they're young.
Start naturally. if you're
Start
young.
naturally. And if unless there is a history of some disease like tuberculosis or endometriosis, or she knows she has fibroids, at which point she can be more proactive.
Got it. There are a lot of supplements that are marketed for fertility nowadays. Folic acid, prenatal, CoQ10.
Yes.
What are there any supplements or minerals and vitamins that you think are essential if you want to conceive?
So if you're having a balanced diet, which can be either veg or non-veg, if you're getting a supply of folic acid from your regular food, you may not need supplements. But today, lot of women and men are trying to conceive at a older age. And there what happens is the cells have less mitochondria. And this has also been shown in studies that for the woman and the male, the mitochondria may go down. If that happens, they need supplements with CoQ10. So there is a role for very significant role for CoQ10. Studies have been done pre-taking and post-taking, and people have shown better fertilization rates in IVF when the couples have taken CoQ. Zinc is very good for sperm motility.
Oh.
Very good. Arginine is good for women's eggs. So there are definite advantages of taking some supplements, but sometimes I see couples coming with a big list of 10-12 supplements, which if they would eat balanced good food may not be needed to that extent. Yes, CoQ10 is very good. It boosts the mitochondria and the energy of the sperm and the eggs. Folic acid is important because it prevents neurological defects in the child. Curcumin I would strongly recommend. That's very good because of the anti-inflammation properties. Omega-3 also strengthens eggs, particularly in women with endometriosis, polycystic ovaries. So by and large, there are some medication that can be taken.
I just want to talk about something that we touched on, which is the mind-body connection.
Yes.
Especially the sin-sex story.
Yeah.
Your own research cites that depressed women may be roughly half as likely to conceive than a normal woman who's not depressed. So is that something you've seen born out of your own experience?
So when I started IVF at Jaslok, I would send all patients who needed IVF first for screening and counseling to my husband Rajesh, who's a psychiatrist. And many a time he would send me a letter saying, don't do IVF. Stop. Wait for 6 months. And I would get very perplexed and angry that here is somebody who's come to do IVF and they're ready to go. And here you are telling them not to do IVF. That would always perplex me. Then we did a study and we literally saw that when their mood improved, when the mood disorders came down, when they went into stable relationships, when they felt heard and seen, the pregnancy rates went up. And many even conceived naturally. So there's a very strong connect between the mind and the body. In fact, in our program, we have a specialist who is a mindfulness coach. And what Shivani does is helps patients who are stressed to first de-stress, have a lot of affirmation techniques, and then we take them through the IVF. We find that doing that, losing weight, being focused on the treatment, being very affirmative about IVF, definitely helps the woman to cope through this very difficult time.
I mean, it's amazing when you say like a depressed woman is half as likely. That means that the mind connection is one of the strongest things.
Very strong.
Because 50% is a huge gap. It's almost like if you are, depressed or deeply unhappy, your body will not be able to have the baby basically. What does the mindfulness coach teach them?
So teaches them a lot in terms of yoga, in terms of affirmative action, in terms of gratitude, in terms of building up one's confidence, spending more time with friends, with partners, and also, of course, talking it out, because so many times couples who are infertile are not allowed, not only they're not able to, but not allowed to express themselves.
Yes.
Because the bottom line is having a baby,
Yeah.
but it takes something to make you attain that. And having a clean, good mind, good friendships, lot of gratitude, yoga, meditation also helps a lot.
Gratitude is fantastic, yes. Stress causes infertility. But infertility causes stress.
Both.
So it's also a vicious cycle.
It is.
Let's just pause. Subscribing here isn't just about supporting our channel. It's about choosing what kind of thinking you want around you regularly. So if that resonates, you know what to do. You've said that you've seen both men and women develop fertility problems at a much earlier age nowadays. What are you actually seeing in your clinic, in the research, and why is this happening?
It's a very good question. I think we are seeing a drastic change in lifestyle. India, as you know, is the hub for diabetes. We are seeing that both men and women are getting diabetes a decade earlier than before. That definitely has an effect on the woman's well-being, on the man's sperm. We have done studies where we have shown that men with diabetes tend to have what is called higher DNA fragmentation of the sperm. And we have published it also. And there is voluntary infertility. People don't want to have children, or at least they want to delay having children till they are closer to the late 30s. Now, a woman's fertility peaks between 24 and 34, but that is the time she's also struggling with her career. So what takes precedence? Is it a family or is it a career? Today, the whole family unit is just 2 people. So that also brings a big change. When there is help in the house, when there is an extended family, rather than a nuclear family, things become so much easier. We take help of our parents. Of course, there is social stress. There is professional stress. I give you an example. A couple, by and large, many times you'll see that the wife is doing a morning shift. The husband is working on the night shift because he's reporting to a bank in another country where it's a different time zone. They're barely meeting. And sometimes when they're working together, I laugh and I joke with them that you're meeting more in the boardroom than in the bedroom. And we see that patients today are not having sex for the pleasure of sex. It's very mechanical. There is always a calculator where the wife will tell the husband, these are my fertile days and let's plan. It just kills the whole passion of having sex. So things are changing, and I think many of these things are contributing to the lifestyle and the change in the fertility rates. Fertility rates are dropping all over the world.
From a health angle,
Yeah.
like men and women having more fertility problems, what kind of any statistics for that?
Well, polycystic ovaries is seen very commonly. Many times about 8 to 15% of the women trying have polycystic ovaries. Now it is called polyendocrine metabolic syndrome instead of polycystic ovary syndrome. That we are seeing is very high. Then girls are having either very early menarche, or they're having late menarche, or they're getting early menopause. So all these are because of changes in our lifestyle, changes in the environment. For men, we are seeing that many men, by the time they're 30 or 35, are becoming diabetic. Planning of their health, they only look at the end of the month, what is the amount in the bank, which is not a healthy way to have a good life. Something very alarming we are seeing, and we have published it also, that young Indian women will reach menopause 6 years before Caucasian women. So that is something that we have to really think about. What kind of children will we be producing, and what are we handing over to our grandchildren? One of the reasons is the use of what are called endocrine-disrupting chemicals. These are chemicals like bisphenol, phthalates, the metabolites of phthalates. These,
What are they found in?
they are found in everything. They are found in plastics, in shampoo, in lipsticks, in cosmetics. Even an ATM bill that you will get is coated with this kind of an endocrine-disrupting chemical. All the clothes that we wear are no longer cotton. They are a mixture with plastic, polyester.
Yes.
And we are always inhaling plastics. You know that.
The plastics from our clothes, the polyester from our clothes can go into us?
Absolutely. So they form tiny beads. Your shampoos have tiny beads. And these have been found at the end of the food chain. We see that in whales. We see that in fish.
In everything.
And in mankind, they have found microplastics in the brain of people, in the stomach,
in the kidneys, in the testes. So this is a way of self-destruction. And this is something that we need to make people understand before it is too late, that we are living in a very artificial environment, and one day it may not harm us, but it will definitely have an impact on our children.
You talk a lot about plastics. And one of the first things when I asked you, doc, was plastics, which for someone would be like, what? A fertility doctor is talking about plastics. So I want to spend a little more time on that.
Sure.
And you talked about that documentary specifically.
Yeah.
Everybody hears about microplastics.
Yeah.
Like you said, they are in shampoos and they're everywhere. Can you tell us a little bit more about that and what that does?
Yeah. So first, let me tell you about a study we did. And it is a very interesting study because it is pre-COVID, COVID and post-COVID. So we looked at the fluid which surrounds the egg. It's called the follicular fluid. And when we do IVF, we can collect that fluid and analyze it for pollutants. We saw that during COVID, because women were at home, they were not using makeup, they were sitting at home and fairly unoccupied with work. They were having a lifestyle which was easy, which was organic. We found that during IVF, all the levels of phthalates, metabolites of phthalates and bisphenol all came down.
All the dangerous chemicals.
All the dangerous chemical comes down. And we compared it to before COVID and we saw that they were dangerously high. We also noticed that the fertilization rates were better during COVID as compared to when there was no COVID. So this is what we are accumulating, and this is something that I want to make people aware. In fact, it got published in a very major scientific journal, 2 of the studies. And this COVID effect really made me think that, look, we have to do something not only for ourselves, but for our children and grandchildren. Because what these plastics do, they are called forever chemicals, or the endocrine-disrupting, they are called forever chemicals. Means they do not degenerate. They will remain in your environment, they'll remain in your body. And that is where they actually bind to the testes, they bind to the eggs and bring down the potential of these very important reproductive organs.
Oh, so what can someone do to avoid that? If whoever's watching this hears that,
Yes.
Oh my God, for all reasons, plastics is bad. What are 3-4 things that a man or a woman should do to reduce their ingestion of these?
So before we go to that, I'll tell you about this movie, which was made by a brilliant professor. Her name is Shanna Swan. And she did a study where she went to people's houses and actually opened up the drawers to see what was the plastic component in the house. And it was alarmingly high. And these were couples who were trying for a baby. I think she had about 12 couples. And over 3 months, she changed their lifestyle. Some of these couples were waiting to do IVF. And a good percentage of these conceived on their own without IVF. So it's a distinct marker that changing your lifestyle, eliminating plastics will make a big change. So your question, what can we do? We have a responsibility to humanity, not just to our families and to ourselves, but to the world at large. We have only one mother planet and we have to protect mother planet. First thing to do is do not have water from plastic bottles. Okay? Use glass, use ceramic, use stainless steel, use copper. That's one way to decrease the burden of plastics. Do not store food in plastics. Many a times, when you take away fast food from hotels and you ask for food on Swiggy or whatever, the whole the box comes steaming.
Steaming hot.
And we relish the taste, but that plastic is leaching out with the heat. And that straight goes into us. That is really something we should avoid. At home, avoid using any Teflon coated pans because these also can leach out chemicals.
PFOAs.
Yes, or foils, or even the saran wrap, the wrap which we cover the food with.
So at home, don't use a plastic container in the fridge, just glass.
Just glass.
No plastic as much as you
No
can.
plastic. Use stainless steel. That is very good.
Stainless steel.
And iron is very good.
Don't connect any food item to plastic.
Yes.
Food and drink.
Yeah.
Remove it from plastic.
Right. Then use of these forever chemicals which are there in lipsticks, in rouge, in all kinds of things that we put on our body. You'll be surprised, even sunscreen sometimes can have certain chemicals which are harmful to us. Talking about perfumes, in our clinic, what we do is when a patient takes an appointment, we say, make sure that you have not put perfume. And sometimes the patient gets so upset with me because she's come with perfume. She says, no, but I didn't put it on my body. It's just on my clothes. And I tell them either there is a washroom, go and wash up, or go home and take a fresh appointment. But it is only for their good. And I'll give you real world examples. In our laboratory, if on a particular day it's very busy and we don't have our ACs working to their maximum speed because they have what is called the air conditioning unit and the air cleaning unit, the VOCs, volatile organic compounds, literally rise and we can see them rising. And that is not good
from
for
the rising from what?
From all the perfume, all the volatile compounds.
From the basically the patients coming.
Patients coming. If there is more patient on a particular day, they're breathing, the carbon dioxide that comes out, all contribute.
But the VOCs are from the patients.
Yes, patients' clothes can give out VOCs.
And you have a VOC meter?
We have multiple VOC meters.
Arre wah.
Every room has a VOC meter.
Nice.
And we have equipment to get rid of the VOCs. That is the key to success in IVF.
Perfumes have a direct negative impact on fertility.
Absolutely.
How does that work?
So perfumes again release what is called everyday chemicals, and these are chemicals that last forever. So you may apply perfume today and you say tomorrow I have not applied. So what's the big deal? But that perfume percolates under your skin, and that is where the harm begins.
Why do you insist that your patients not have any perfume when they come to you in your clinic?
Because the VOCs in my lab go up.
Oh.
And they should not be putting things which are not natural because it will have a long-term bad effect on the sperm and the eggs.
On the sperm and the eggs?
Absolutely.
It's for men and women?
Yes, yes. When an IVF clinic is very close to a factory or a traffic light
or a ground floor?
Or a ground floor, it's very dangerous because all the VOCs are coming in.
Yes.
That is why all IVF clinics have VOC meters. All good IVF clinics
Really,
have
that's
VOC
so interesting.
meters.
I read that large global studies have showed a major decline in sperm concentration in men over the past few decades. What do you see with Indian men?
So, a lot of studies have been done with Indian men and they're a little controversial. Some studies have shown a dip, shown a fall. We have not done a very large study, but we have seen over 13 years, about 13 or 14 years, and we have seen a trend to a dip. We are seeing a slight dip in count, in motility, and in the morphology.
In your experience, what do you feel? One is the study, and in your experience, do you see a big dip?
I do see a dip. When I started, say 30 years ago, I would see on an average men having a count of 50 million, 60 million. Today, if I see a man with a 30 million count, I'm very happy. And we do see very low.
So in your experience, you've seen a 50% drop?
Yes, but it's not been statistically analyzed.
But your vast experience?
Yes.
And for women?
For women, we are seeing a very low AMH.
Right.
We have never seen such low AMHs. We see girls at the age of 30 having a AMH of 0.3, 0.4, which is what a 40-year woman would have.
Got it.
So we are seeing big dips, and the sad part is a woman comes to us at 28, her AMH is good. At 32, her AMH is dismal. So
and why does that happen?
I think because of the constant exposure to all chemicals, not only as a child, but when she was in a mother's uterus. So it is what is called transgeneration. This goes from the mother to the daughter to the daughter's daughter. So that is why it's called transgenerational.
So pregnant women have to be so much more careful.
Absolutely.
Can you give us some tips, Doc, for anyone who's listening, what they should look for in an IVF clinic?
Yeah. So transparency is the one thing one must always look for in an IVF clinic, don't go only by social media. Social media will give you some science, some facts, not all.
Right.
Go by the reputation of the doctor. Go by how... I always like doctors who look you in the eye, or I always like people who can look at you and also be able to say, sorry, I've made a mistake. Oh, your diagnosis should be this. So look for transparency, look for the results, and look at the lab. See what the lab results are. What are the KPIs in the lab?
You can see that?
Yes, you can ask a clinic, what are your KPIs? What is your fertilization rate?
Oh.
What is your blastulation rate? What is your pregnancy rate?
Do people ask that?
Very few.
Yes.
But I think these are the things you really need to look at. Also see how detailed the history is the doctor taking. Is the doctor listening to you or he's on the phone? I would advise somebody that if you are going to see a doctor and the doctor uses the mobile, you can politely tell the doctor, can your phone wait, or should I come back on another day? Because in my clinic, 2 things are not done. I don't allow people to wear a watch. By and large, they don't. I've never worn a watch because I say then my time is not my patient's, it is my time. So I don't wear a watch. And I like people to be transparent, and I like patients to be transparent.
You don't wear a watch because of your patients.
I never wear. There is no wall clock also.
And your staff also are told not to wear.
By and large, they don't wear. The senior doctors don't wear.
Because they can spend time with the patient. They can be present, basically.
They can be in the present moment.
Unbelievable, doc.
Yeah, we don't.
What a story. I'm speechless.
Are
That you don't wear a watch because of your patient. I have never heard something
I don't.
so magnanimous. I don't know what better word is, or compassionate in my life. Or diligent.
No, it is respect to the patient. No.
Amazing. If a couple are having problems conceiving naturally, what type of treatments are available today?
So there are many treatments starting from planned intercourse. Planning the time of intercourse is also very important. Then doing follicular monitoring, where the sonologist will look at the egg, when it's likely to ovulate. Doing a man's semen count and motility parameters are very important. A simple test like that. Doing hormone tests like AMH is important. Sometimes if there is a doubt that the tubes are blocked, then doing a hysterosalpingogram or a laparoscopy is going to help. Then there'll be more specific tests. If you're looking at the uterus, looking for fibroids, then you may need a 3-dimensional sonography, even an MRI. So it all depends on the reason for the infertility.
Got it.
It can go from a simple test to something which is very advanced.
For someone who's never seen the process, can you take us through one IVF cycle from the first injection to the baby being born?
Sure. So basically IVF will, once we decide that this couple will need IVF, all the basic tests are done. The screening is done. And we make sure they have taken their supplements, everything is in order. And then we usually starts from day 1 of the period or the day 2 of the period. These injections we calculate depending on the AMH and the age of the patient. Once we do that, the injections start from day 2. Before we do this, the man's one sample of semen is frozen just in case on the day that he has to actually give the sample, in case he has fever or he cannot make it, then we have what is called a backup semen. Once the injection starts, by the 5th or 6th day of the injection, we start doing the scans and look at how the follicles are developing. And usually she would be ready to get the trigger, that is to mature the eggs by day 9 or day 10. And once then the egg retrieval is done under anesthesia, the eggs are then incubated carefully and they undergo a process where they get ready for the injection of the sperm. A single sperm is injected in the egg. And then that is kept in an incubator and observed till the 5th day of development, at which time it is then frozen. The embryo is frozen usually on the 5th day.
Got it. On the 5th day, right?
Yeah.
Doc, I want to talk about ICSI.
Yeah.
It sounds like ICSI, which is an exam that we all did.
Yeah.
But you helped bring it into Indian practice.
Yeah.
So can you tell us what is ICSI and
Yes.
how many people's lives has changed?
Oh, I think thousands of people's life has changed, because earlier a man who didn't have sperm or had very little sperm, had no option to be a biological father. He would have to think of donor sperm or adoption or go childless. So ICSI is the injection of a single sperm inside the egg. And we were very fortunate because when I was at Yale, we started doing ICSI on mice. And luckily, when I was invited to join Jaslok Hospital, the management, the trustees listened to what I said, and we got the latest equipment to start micromanipulation. I joined in 1980. I joined Jaslok in 1989, and we had a long learning curve because the first ICSI in the world was in 1992. So there was no precedent till then, and we had to practice. We had to sharpen and make little glass pipettes on our own in the lab. And in 1994, we succeeded with the first ICSI pregnancy, and that revolutionized medicine, reproductive medicine, because now couples who were having male factor infertility could father children. I remember when we started, there was no other clinic in India who was doing it. And our waiting list for appointments, unfortunately, was almost 6 months.
Right.
And that would always irk me because I said, why would a patient want to wait for 6 months to see me? But there was such a rush, particularly for men who had a problem. Of course, then we had a lot of workshops. We taught a lot of other IVF specialists how to do it. And today, ICSI is a very common word in India, but it all began at Jaslok Hospital.
Amazing.
Yeah.
What does an embryologist do?
Yeah.
And it's such a fascinating thing because they have to choose the one embryo out of many and choose which is the best one, which is
Yes.
going to be your child, basically.
Yeah. So there are many signs of a healthy embryo or an unhealthy embryo. If a embryo is dividing well from day 1 to day 5, it is following the curve and dividing the cells. When an embryo starts, it's 2 cell, then 4 cell, 8 cell, then it has more than 100 cells, and finally becomes a blastocyst.
Yes. That's true. We forget that it all starts with 2 cells.
Yes, it starts with 1 cell and then
One
2
cell.
cells. And the way the embryo looks, the way it divides, there are 2 components in the embryo. One is called the inner cell mass, which becomes the baby, and the other is the trophectoderm, which becomes the placenta. So one can actually grade the embryo in the lab and select which is the best. Today, we are using artificial intelligence where there is a score. The pictures are fed into a system, and then we come to know it gives a score, which is from 0 to 10
For each embryo.
for each embryo.
And how big is an embryo at that point?
100 microns to a little more than 100 microns.
Which is like what, the diameter of a human hair probably or something.
The tip of a tiny
pen.
pin. Yeah.
Tip of a tiny pin.
Yeah.
And how many embryos do you have typically for one person?
It depends on the AMH. We can go from 1 embryo to even 20 embryos.
Right. So you'll have between 1 to 20
Yeah.
dots.
Yes.
And then using AI and the embryologist, they study that and they will see the quality.
Right. And then select the one which has a score close to 10.
Wow. And can the best embryo still result in a problem or a miscarriage or something?
Yes, because if an embryo is not tested genetically, it may look completely normal, but it can still be genetically abnormal.
Because you're only seeing it visually, basically.
Right. But
Got
we
it.
can actually test the embryo, taking out a few cells from the placental side of the embryo by what is known as pre-implantation genetic testing. And we can come to know whether genetically, chromosomally, the embryo is normal.
But at that point, it has to be a little bigger. It's divided a few times.
It has divided, but it's still just the tip.
I just want to talk about the other side of IVF, which is failed cycles.
Yeah.
One failed IVF cycle sounds like one event, but actually it can fail at many different stages.
Right.
Could you take us through what can actually go
Yeah.
wrong?
So I think a failed IVF cycle, by definition, is a very devastating effect on the couple. Failure is not looked at failure of a procedure, but it's like a woman has failed or the man has failed. So one has to take the couple very gently and explain why it has failed. The failure can be on the part of the sperm, on the egg, the embryo. It may not be a normal embryo, or it may not become an embryo. And even after putting in it, it may not implant. It may implant, but it may not grow. It may grow, but it can miscarry. So these are the things, these are the pitfalls that we have to warn patients before they undergo the IVF. And it can be quite disheartening when cycle after cycle can fail. So one has to, that's for let couples know that IVF, one has to be very realistic of success, and it's very difficult to tell a patient that, oh, it will work 100%. In fact, what I do is I always quote a figure of success much lower than what it is, because that way the person is grounded. Person doesn't feel that IVF is, everything being excellent. So one has to be a little cautious in how one allows the interpretation to be taken. I know I have couples who have come back very angry after a failed cycle and tell me that, look, we came here thinking we'll get a baby, but it hasn't worked. So then I take them back through everything to explain why it has not worked, why IVF has its own limitations.
So like what percentage do you give people usually?
Depends on the age and the sperm parameters. If the patient is young, it can go to as high as 60%. Patient is older, it can go to as less as 10%. So there are a lot of variables.
So you move between 10 and 60?
10 and 60 usually.
You never go above that, right?
If we do surrogacy or donor eggs for a couple, then with surrogacy it can go to 90% plus.
Because a young person and...
Yeah, somebody who is healthy and fertile is carrying the baby. If it is donor eggs, again, these are young donors, it can go to 60 to 70% plus.
And what do you change about how IVF is marketed and sold in India?
There's a very dangerous trend that is emerging now in IVF. And I think there has been a merger between finance and IVF. And this merger has caused a lot of disturbances for not only doctors, it has disrupted the whole industry. And I'm saying disrupt not in a very nice way. It has caused different chains of IVF
chains
to proliferate. And the bottom line there is not the success or the comfort of the couple, but how many cycles are done in a particular month. What are the targets? Now, words like targets are used, which I think is very demeaning for a science which has been cultivated with so much involvement. So I think this chain is not healthy. This change in the relationship between finance and IVF will cause a lot of disastrous moments.
Corporatisation.
Yes.
In a lot of medicine. A lot of medical areas,
you
can see this happening where you have a for-profit.
Yeah.
And then automatically you have targets.
Yeah.
Because you've invested 100 crores
Yeah.
in the great place that you built. And then you need to make some return on it.
Yeah.
So the team is just set up in that way.
Yeah.
And even the doctors then are...
They're induced, no?
Yeah.
They're induced to maintain those targets. And that is a very unhealthy way of practicing medicine in whatever, whether it is IVF or any field.
I just want to talk about how AI is changing IVF.
Yes.
You mentioned AI in embryos.
Yeah.
Generally with AI, what has changed in clinical practice?
Lot of things have changed. We take the help of AI lots for grading embryos, for putting in the best. There is AI today available for deciding the dose of injections, the hormonal injections. There is AI now to pick up sperm. There is robotic ICSI now available, which uses a lot of AI. So I think the whole field now is moving towards AI.
Wow. What is an ectopic pregnancy and, how dangerous can it be?
So ectopic pregnancy is one condition one has to be very aware of and very astute on. It's a pregnancy that happens either in the fallopian tube or on the ovary or on the cervix or on the abdomen, some organ inside. One has to be, if woman misses a period, has a little cramping, feels little giddy, these are the signs of an ectopic. Such a woman should immediately rush to a sonologist or to a doctor, get the exact location of the pregnancy, because one can lose one's life if the ectopic is not caught on time. The patient can bleed a lot and have a lot of complications. So it is one emergency that one has to be very aware of in gynecology.
And how common is it?
It's not very common, but in India, because there is a higher risk of genital tuberculosis, it is much more common than in the global population.
Can we talk a little bit about, you've talked about it before, so what is genital TB?
Yeah, so genital TB in our country, 1 out of 6 or 7 people are exposed to TB. They may not have the full-blown TB, but they can have what is called latent TB. Sometimes when the immunity of the body changes, this latent TB converts into active TB. And it can also become extranodal or extrapulmonary. And because the uterus and the tubes and ovaries are very rich in blood, okay, and there's a lot of vascularity, if the TB organism, which is called Mycobacterium tuberculosis, if they lodge in the uterus, then it starts the infection in the tubes, ovaries, the uterus, and usually blocks the fallopian tubes. Sometimes the tubes are just blocked partly, and that is the dangerous situation where a partially open tube can lodge the embryo and cause the ectopic pregnancy.
And how common is genital TB, have you seen?
Genital TB is not common in that sense. It can harbor in the body for a long time, but in infertile women, it can account, and those who have blocked tubes, it can account for 8% of a problem.
So it's something to test for.
Yes,
for sure.
absolutely.
Just want to talk about miscarriages and repeat pregnancy loss. What is the most common cause of miscarriage?
So the commonest cause for miscarriage, 70% of miscarriages are because of a genetic problem in the embryo. Sometimes a woman won't even realize that she's pregnant. Her periods may get delayed for 3 or 4 days, and nature resolves the pregnancy when it is abnormal. Other reasons can be that the uterus is weak, or there are metabolic conditions like obesity, PCOS, diabetes. These can also contribute.
Right.
Sometimes there's an immunological factor that can bring about a pregnancy loss.
Got it. Your book, there was a story about a woman who miscarried 7 times.
Yes.
And became terrified of becoming pregnant again. And you eventually found something in her uterus. Could you tell us about that?
This woman had an abnormal shape of the uterus, where her uterus was practically into 2 parts, because there was what is called a fibrous tissue which was protruding through the uterus. Now this was decreasing the space in the uterus, and that was causing her to abort several times. It was a very simple procedure where, using a hysteroscope, a telescope was put into the uterus and this thick band was cut. And of course she conceived naturally and carried the pregnancy to term very, very soon after that.
Wow. How do the risks of miscarriage, chromosomal abnormalities, gestational diabetes, and high blood pressure change with age?
Well, as a woman ages, there are more inflammatory changes. She's more likely to become diabetic, hypertensive. There is less blood supply to the uterus, and that could trigger a miscarriage.
So is every pregnancy after, a certain age, like 35, they say 35, a geriatric pregnancy, is it high risk?
I won't say 35, but I would definitely say 38, 39, 40 onwards, there is a higher risk of all these comorbidities. As a woman ages, and if she's not looked after herself, the problems of less blood supply to the uterus comes in.
Right.
The diabetes creeps in, the high blood pressure creeps in. There can be cardiac issues. All these indirectly will contribute to making it a high-risk pregnancy.
Got it. And are babies conceived through IVF or ICSI as healthy as babies who are conceived naturally?
Yes, there is a lot of data today which shows that they are as healthy as babies born normally. There's a recent study, however, that shows that there's a slightly higher percentage of heart abnormalities in babies born through ICSI. So, sporadically, there are reports showing that children born of ICSI can have some congenital malformations, but that doesn't mean every second baby has this. But yes, there is a propensity showing slight increase in some abnormalities.
But not in IVF, in ICSI only.
In ICSI, most likely in ICSI. Today, IVF is hardly done. It is mostly ICSI that is done.
Oh, IVF is hardly done?
Hardly done. Because ICSI is short fertilization. You're putting the sperm inside the egg.
Got it.
But yes.
So now the new IVF is ICSI basically.
Yes, the new IVF.
You say IVF, but it's actually ICSI.
Actually ICSI. And we tell all our patients about this risk, which should never be hidden from patients, because there is a small potential risk of certain congenital abnormalities.
Got it. Do fertility injections cause weight gain?
Weight gain? Well, what happens is
the metabolism has more of progesterone in it. So there is a ability of the body to retain more water. Therefore, the woman feels bloated. But after doing an IVF, whatever so-called weight gain is there, it's only usually water retention. And if a woman gets back to her exercising and gets metabolically fit, I don't see any real fat weight gain in the woman.
Got it. And do IVF medicines increase the long-term risk of any cancer like breast cancer, ovarian cancer?
Earlier, there was a thinking that hormones can produce breast cancer, ovarian cancer, but many studies have shown that there is no higher risk.
So it's absolutely not connected.
Yes, it has been disproved. All these so-called theories, lots of studies have been done, and no study has shown that, okay, because you did IVF, now you are at a higher risk for cancer.
In your book, you have this whole thing, a chapter on Farah Khan, who she was 43.
Yes.
And she had triplets.
Yes.
She was carrying triplets.
Yes.
And she was directing, I think, Om Shanti Home, her biggest movie, and walking on the fashion ramp and working.
Yeah.
It's very tough directing movies. I produce movies. What worried you the most about this whole thing?
My worry was she refused to take rest or bed rest, and she was all over the place. With triplets, I was very worried that she'll deliver prematurely. But Farah being Farah, she went 2-term. So my biggest worry was premature delivery for her.
Amazing, no?
Yeah.
Actually, amazing.
Amazing. She's an amazing woman.
I've been on movie sets, so to direct a movie anyway is a mind-blowing situation. Forget about being pregnant or not. Then you're pregnant with 1 baby, 2 babies, 3 babies.
And I would call her at least once in 2 days. Farah, where are you? No, doc, don't worry. I'm taking care. And where is she taking care? She's producing a movie or directing a movie in the studio, lying down on a couch. So that was a bed rest.
That's amazing.
Yeah.
And what do you see happening in the future? Any big breakthrough you see happening in the future?
One of the breakthroughs that will occur sometime or the other is with stem cells, which actually offshoots of IVF. The whole precision medicine, use of stem cells, use of IVF for eliminating diseases, like if there are patients with thalassemia, that we are already doing. If there are patients with sickle cell anemia,
you can remove that.
We can remove an embryo which has the disease, not the disease itself. So we can put in a healthy embryo. We have been doing this pre-implantation genetic testing for various disorders. For Duchenne's muscular dystrophy, for Huntington disease, for many, many conditions, which otherwise would be lethal to the baby.
Got it. I want to talk about having a healthy baby at the ending. Before a couple even begin trying, what should they test for? Family history, genetics, etc.
Yeah. So if there's any history of any genetic disorders, it may be worthwhile to test out those disorders by doing genetic screening. If there are history of any cancers, sometimes breast cancer can be carried through because there are certain genes called BRCA1 and CA2. It may be worthwhile to get the couple tested, even the man, if there is a family history. So screening is very important, Bukul, I think, to ensure that the pregnancy is not affected and the baby is healthy.
Your book describes a couple who underwent IVF, had a child, and only later discovered that both parents carried the dreaded thalassemia.
Yes.
And the baby, of course, had thalassemia major.
So thalassemia is a very lethal condition, and thalassemia major can not only disturb the parents, the siblings, the entire family, and the family spend up to 90 lakhs treating a patient or a child with thalassemia. So it is now mandatory that couples who are coming for infertility are tested for thalassemia variations. And that is a rule that must be followed even for couples who are married and wanting to try naturally and get pregnant naturally. It's a very simple test. I think it should be made mandatory to test all couples, particularly certain
communities like Sindhis, Kachis, Punjabis who have this variation in the gene. And we had a couple who came to us because their first child had thalassemia major. Of course, we did IVF and we could eliminate those embryos that had the thalassemia gene. And we were also able to match the baby's stem cells with the baby existing with the thalassemia and manage the couple then after having the sibling could give the bone marrow once the child grew up to the child who had the thalassemia, and now the baby is free from thalassemia.
Really?
Yes.
So how old was the child when they got the bone marrow?
Child became 3.5 years old after they took the bone
And
marrow.
with the bone marrow, he or she got cured.
Completely.
Wow.
Yeah.
That's a crazy story.
Yeah.
Wow.
Very bold couple. They went through, in order to collect the matching genes, they went through 3 IVF cycles to get enough embryos.
They had
But
to be
they
sure,
were-
right?
yeah.
Right.
But they were very determined.
Right. They want to save their first child
Yeah.
also, right? Of course. If there is a known BRCA mutation or a strong history of breast or ovarian cancer in a family, what should a couple do when they're planning? What should they do with that information?
Yeah, so this information is very relevant. Both of them should do what is known as whole exome sequencing with carrier screening. Means look for the particular gene, whether it is present in them. And if they have it, and if they have the ability to do IVF, if there shows a pattern of inheritance where there's a chance that the baby may get it, then it's worthwhile doing IVF, only transferring the embryos that are free of the cancer gene. Today we have technology. I always tell people, we have technology. Why don't we use it to the betterment of humankind?
That's so interesting. So even people, like if you're with someone and you want to have kids, even if you're not thinking of IVF, do your screenings.
Absolutely.
Because then you may have to do IVF, not from a fertility standpoint,
Yes.
but from a protection of the child standpoint.
Right.
I never thought of that. I'm going to close with, I'm just going to give you 4 types of people and tell me the first thing each one should do. So woman, I'm a 25-year-old woman. I know I want children later, but I'm not ready now.
Yeah. So do your AMH. If you're going to get a partner or get married within the next 2 years and your AMH is good, relax. If you find that your AMH is on the lower side, please freeze your eggs.
I'm a 32-year-old woman. I am not ready and I have not found the right partner.
Please freeze your eggs.
I'm 38 and I want to start trying now.
Please do it ASAP. Try today, if not tomorrow. And because you are 38, there's a very good chance that you will need IVF with genetic testing, pre-implantation genetic testing.
I have already had 2 failed IVF cycles.
There's no such thing that you cannot conceive. Let's look into the reasons why the IVF failed, and we'll give you a prognosis of whether IVF is going to help you or not.
And Doc, you have been doing this for 35 years. What made you specialize in this field?
I was always very taken aback as a resident when I was at Wadia Hospital, looking at the sad faces of some women who had forgotten to smile. They just wouldn't smile because they were, I won't say harassed, but there was a constant nagging that you don't have a baby. And this was not a very elite hospital. It was a hospital for general people. And doing my residency there, I could always pick up a patient who was infertile. I would look at her and I would know that something is not right for her. And that somehow set me going, thinking that if these are the women who are suffering the most, if something could be done for them. And at that point, IVF was just like a dream. It was just starting. So that is when I decided that I will not do general gynecology, but go into IVF, fertility management. And I had some very fantastic teachers. I had Dr. Mahendra Parikh, who was an expert in microsurgery. I learned all microsurgery, like tubal anastomosis from him. My other mentor was Dr. R.P. Sonawala, who was also a microsurgeon. He was also an infertility specialist. So I think I benefited a lot from being under the shadow of giant banyan trees. So that made a big difference
to me. And then I had this opportunity to go to USA. My husband Rajesh, who's a neuropsychiatrist, he got a fellowship at Johns Hopkins. And at that point, I had not yet got a fellowship, but I said I'll go there and pursue. And then luckily, I got a fellowship at Yale. And we were there for 4 years. We enjoyed every minute of it. We had our first son there, Swapnil, and it was difficult, but it was worth every day that we spent over there.
I wanted to say thank you so much. It was really amazing. It was really fantastic talking to you.
So
it was really a pleasure.
Thank you. I had a lovely time with you and your crew. They are simply fantastic. And I really wish for you all to do more stories, things that touch people's lives and brings about a self-growth and awareness in people.